Hi, I'm Dr. Haffiji from Matrix Dental Specialist. Today we're talking root canals. So at times, perhaps not enough time for the anesthetic was allowed to set in and complete anesthesia wasn't achieved, and you end up you're working on a tooth that is hypersensitive, they're sparking away, sending impulses rapidly, and you end up drilling onto a tooth and then there's pain. I think today practicing slow dentistry and allowing that time for anesthetic to work in, the correct pre-medication if necessary, a root canal process can happen a lot more comfortably, efficiently and predictably. So I think for those of you that are concerned about root canals, I'm saying don't be as agitated or anxious as what you should be or what you think you should be, because it's not as bad as what it used to be. Patients sometimes ask, can we not take antibiotics? Antibiotics do not eradicate the infection. They may reduce the signs and symptoms of the infection, but fundamentally the infection is this capsule in bone that has bacteria in it. And the only way to get there is to disinfect, debride, medicate, and that's how the infection goes away. Bit of anatomy on the tooth. The tooth itself has the outer enamel and it has the inside dentine. The enamel itself is the hard surface that we see. The dentine is a bit softer that lays under the tooth. And then just below the dentine happens to be the nerve or the pulp chamber of the tooth. And that's in essence where the nerve impulses from the brain go all the way down through the jaws into the tooth itself. So when a root canal is indicated, happens in generally one of two reasons. Either there's been a traumatic insult to the tooth and now the pulp has become exposed, or there's pathological insult to the tooth, meaning simply dental caries, and the pulp has become exposed to the outside environment. What then happens is you either have an acute situation of where there's pain and inflammation, or if there's no pain immediately, you end up with a chronic situation of where now this exposure of the pulp and the nerve of the tooth has resulted in an infection around the root of the tooth. And this can be there getting progressively worse for weeks, months, and sometimes years. But in essence, the only way to eradicate this type of infection is to have a root canal treatment carried out. On the top end of the tooth, when the nerve is exposed at the top, you can't just put a filling on the nerve or in the nerve, because then obviously you're going to have pain. So this is basically the two bigger indications for a root canal. The first step of the root canal is obviously identifying the correct tooth. There's times when you have multiple teeth that could look to be suspicious, and there's various tests and means that we do or carry out to achieve this. Initiate anesthesia and then we place a rubber dam. A rubber dam in simple terms is a sheet of latex that has a little hole punched in it, and that exposes, or the tooth that we're working on protrudes through this piece of latex. So in essence, we are isolating the tooth to improve visuals on our side, and from your side preventing contamination or recontamination of saliva entering the tooth. The tooth, as shown, is open and the cavity is excavated and the caries or decay has been removed. But in essence, to get correct or direct access into the canals of this teeth, we use a series of disinfectants, and then we use these thin little files that I'll show you later on, which have little flutes in them to help clean up the canal itself. So we're basically going with chemical disinfection as well as mechanical debridement of these canals. A root canal can be carried out in a single sitting or at times multiple sittings, depending on what the clinical situation may be. If there's infection, we obviously want time for the medication to work, so we would carry out a root canal over 2 or 3 visits. So then you get a sick note for work, so you have the afternoon off. Once we are satisfied that infection has been completely eradicated, then we are able to fill the canals, or what we call obturate the canals. A material is used where sealant is placed in the canal as shown, the material is placed into the canal, and then a filling is eventually placed over the tooth. The restoration of a root canal treated tooth can vary, and that becomes a whole separate conversation that we'll have later on. Thanks a lot for watching.